State and county administrators, policymakers, technical assistance providers, grant makers, and researchers participated in a roundtable in December of 2014 to discuss how to increase the use of research evidence in child welfare. This video highlights some of the conversations around what constitutes research evidence, why research matters, why using research is such a challenge, and some ideas for how to overcome challenges in using research evidence. We believe that increased use of research evidence in child welfare will ultimately improve outcomes for children and families and result in more efficient use of resources. This will happen through more informed decision-making, increased use of evidence-based practices, and ongoing evaluation for accountability, client satisfaction, and program improvement. We know research evidence is not the only source of information needed, but it is a critical source to ensure thoughtful policies and a high-functioning service delivery system.
Trusting relationships matter. You need to cultivate trusting relationships. Intermediaries are critical for connecting research to policymakers and practitioners, and for informing the research questions that are done. And research use is most likely when people have the opportunity to have debate and have discussions about it, to help them make sense of it for their own context.
Particularly useful in these partnerships are what I call a culture broker, somebody who understands both research and policy or practice. And many times it's that person who's had experience in both of those realms who seems to be able to translate for the two different communities or two different sets of partners as to what constitutes an effective use of research evidence.
Our colleagues from across the country said, I don't work with researchers because they just want my data, right? And they don't really want to know, right? I'm just thinking about some of they don't really want to know what I need or what my agency needs. And I think that's true. I think a lot of people a lot of leaders in the public sector feel that way. I think it's, about partnerships and changing the culture.
What is it that the field is actually implementing, which suggests it's actually feasible to implement or doing that might be ripe for evaluation? What's coming out of the field is relevant to the field, and what we need to bring to that to bear is sort of the rigor that we have to offer in terms of a scientific process of identifying that. And that through that, we might actually not have to spend a lot of time focusing on further uptake because it's already something that has traction in the field.
If we were having this conversation back in the 90s, the conclusion would have focused largely on all we need to do is to get the evidence there and to get the data there, and people just will know what to do with it, right? And we've evolved since then and increasingly are aware that there's got to be an active and engaging process through which we achieve that translation.
When we have things like research studies coming out, and I think this speaks more to not just being interventions, but how do we actually translate evidence coming out of the field and then do that in a way where people actually have an action step at the end. So it's not just a communication tool, but we call it's a knowledge to action kind of thing.
If you can't tap into the value system with research and with data, and it just becomes a whole series of numbers, it becomes discounted, but you need to show the why.
The integration of research evidence involves a problem-solving process. It's not like you introduce it and suddenly the problem is fixed. It is always a problem-solving process that involves communication between between a number of people, and making sure that the right stakeholders are involved in the collaborative process from the beginning and throughout.
So in trying to understand the organizational factors that facilitate the use of research findings, one of the things we found is that organizational culture does make a difference. So agencies or organizations that had a fairly common model or a consistent set of beliefs, but those beliefs were research evidence isn't all that important, didn't advance very far. Leaders of child welfare systems routinely create and utilize networks of other systems or networks involving their counterparts in other counties as a way of gaining access to information, advice, and as a way of pooling resources. The larger those networks are, and the higher that there are levels of what are called in the social network analysis literature in-person centrality, or the extent to which people come to you for information and advice, the further along counties have moved towards successfully implementing evidence-based practices.
You can purchase something and think you've purchased evidence, but unless you have that embedded in a process and you have a mechanism to check ongoing, you don't know over time that what you have is really even what you intended to have.
We've actually worked as a leadership team to define quality. What's quality? And quality in our 4 pillars are looking at communication, consistency, accountability, and critical thinking. Because just because you have something that's new, if you're not accountable to that, if you're not critically analyzing that with how things fit together, again, I think it can become easy to miss the boat.
Organizations that effectively use research evidence have cooperative, trusting relationships between researchers and child welfare leaders that allow for a greater flow of information and a higher degree of collaboration. These organizations employ trusted intermediaries, such as in-house researchers or local university faculty members, to help bridge the research to practice gap. And they have regular opportunities to discuss and debate the role of research in most effectively serving children and families. In summary, increasing the use of research evidence in child welfare requires developing research studies that address the most pressing needs of agencies and communities, expanding access to knowledge, applying research findings, and continually evaluating the impact of programs. Improving outcomes for children and families requires increasing the use of relevant research evidence. Increased use of research evidence will result in better decision-making, more efficient use of resources, more targeted implementation of evidence-based practices, and ultimately, better outcomes for children and families.